Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender. Okay, I can do it.
Yep. It's built in now.
Okay, John, I guess you want to get started. Yeah. It's an interesting article on warning signs that your mental health is deteriorating. And he identifies 10 signs. And when you have these, you should reach out for help. And he points out that we should no longer worry about this so-called stigma of mental health, which we really are fighting a battle against. Changes in sleeping patterns, sometimes sleep too much, sometimes not sleeping at all, which may identify anxiety or depression. Appetite, and a loss of appetite is often a sign. Social withdrawal is one of the signs that really suggests you need help. Isolation and loneliness, the beginning of the end for many. And then your professional academic performance may go down, which is students drop grades and otherwise wonderful professional people become unprofessional. And then, of course, fatigue, dizziness, lightheadedness means you need to look to find out what's causing that, whether it's real or imagined. And then, of course, headaches or extreme fatigue are symptoms we should explore because that's not normal. And then feeling stressed, sad, or having difficulty concentrating for longer than a week or so is significant because we all can have sadness for a short period of time, especially with some of the events that we are associated with. And as you age, you lose so many friends that you may have short periods of depression. But when they last for more than a week or so, then it's a cause for concern. And then if you find people who stop bathing, brushing their teeth, wearing clean clothes, that's a sign you need to do something. And then as well as a change of sex desire, active or underactive. And then using alcohol or drugs is a tremendous red flag for need for help. And then if you start thinking about killing yourself, and they emphasize the 988 number to use for anybody. And remember, we've had these long discussions about it. And the important thing is, if you know somebody who needs help like that, you need to take them to help if they won't go themselves. If you can encourage them to go with you, that might be helpful. Now these are some of he has identified some 6 or 7 steps that you could do. Get 8 hours of sleep a night, eat a healthy diet, and hydrate with plenty of water. Avoid drugs and try to surround yourself with positive people. Take care of yourself and share your thoughts with others. Any comments on this excellent article on dealing with your mental health, which we're reminded that you can't have good health if you don't have good mental health.
That's true.
I didn't see on the list if you losing a whole lot of chess games in a row. That's a sign of mental
pain. That's not a sign of mental illness.
What's that a sign of, Doctor?
That's a sign that you need your heart evaluated.
No, not chess, but CHESS.
What did you say?
CHESS.
You need to go to a clinic or I have a course, and anybody part of this support group, I'll give them a discount on my clinic lessons.
All right.
But Tatum, you said chess what?
I said it's a sign of mental decline when you lose a lot of chess
When you
games.
lose at chess games.
Yeah.
I see. Okay.
And
Yeah,
I'm gonna
that's
allow
only if
anybody.
you're used to winning. You know, some people aren't used to winning, so they lose all the time. So that's not a change for them. But if you're a winner and then you suddenly start losing, that's interesting. Yeah, okay. All right. Any other comments about that?
Just looking at that, all those about 8 hours of sleep, particularly the one of surrounding yourself with positive people, those things, whether you're in mental health decline or not, all of those things you should be doing, each and every one of them.
Any other comments? Okay, we'll go to the next one. This is an interesting one about why young people are having strokes and what to do about it. And it is an observation that more young people are having strokes. And so the question that they're asking is that real or imagined? And if so, why is it happening? And what should we do about it? And I think that it's clear that this is something that is we're more aware of, whether it's related to people who've taken cocaine or whatever, but it's actually involves people who have diabetes, high blood pressure, and high cholesterol levels. Of course, the risk factors remain, whether you're young or old, but we're seeing much more of it now than we used to. And of course, our children and grandchildren are now having these issues. And what do you think is the most important thing if you have a stroke? And this article talks about how every minute you delay for going to the doctor after stroke, you lose 1 million neurons for every minute. So the sooner you get to the doctor, and he talks about the Be Fast acronym, which is an acronym which addresses balance, vision or loss of vision, face drooping, arm weakness, speech difficulty, and finally, if you have any of these, you need to call 911 and have somebody take you to the emergency room. Shouldn't drive because you may not make it. So you should have somebody take you to the emergency room as soon as possible. And in many instances, the sooner you get there, the better. And the earlier you get there with your symptoms, the better, because we now have ways of dissolving clots and really preventing a lot of the disability that used to be associated with the strokes, if you get to the hospital in time. So knowing the Be Fast acronym and what it means is very important. Brooks, you had something to say? No? Okay. Any comments about this excellent article and strokes, and especially for us and our children and grandchildren?
Yeah, I've got a comment, and this is okay. Just an observation, a difference between this generation and our generation. 80% of people from 13 to 18 listen to their music on earphones from 1 to 3 hours a day, and that's how they consume most of their music. Most of their music is loud, and young people today, including young adults, have more incidents of hearing loss, and hearing loss is associated with increased risk of stroke.
Okay.
So
thank
maybe
you.
I'm connecting the wrong dots, but I don't think so.
Any other comments?
Dr.
Okay, I
Cal-
think
good morning, everyone. Um,
I go.
you mentioned drugs. I didn't hear you mention cannabis. Do you think that have anything to do with it?
I haven't seen any reports about cannabis causing increased incidence of stroke. Cocaine, without question. Cannabis haven't seen a lot of data that connects it to strokes.
Okay.
Any other comments or questions? If not, it's a very important concept to be aware of the need to get to the doctor as soon as possible. I had a relative who had lost sight in one eye, but because it happened at night, they decided they'd wait till the next morning. Well, that's too late. You need to go to the doctor immediately. And by the time she got there, it was too late. They couldn't do anything about her vision. So if you have any of these BFAST symptoms, then you need to get to the hospital immediately and have the ambulance pick you up. Don't drive, because you may never get there. Of course, you can have somebody else drive you, but you should not drive yourself. Okay, next article then. This is a article that really, urinary tract infection is something that doctors usually identify when you have symptoms, and sometimes people have infections and have no symptoms. So it becomes important for the doctor to be able to get a urine specimen from you and to identify whether your urine is loaded with bacteria. And if it is, then you have a urinary tract infection, whether you have symptoms or not. Urinary tract infections are common and are often easy to treat when they're recognized early. And one of the signs and symptoms of a urinary tract infection, sometimes frequency of urination, burning of urination, high fever, and one of the things that is disconcerting is the fact that we now are developing bacteria that are resistant to antibiotics, and so becomes important to identify what bacteria are in the urine and to treat them with specific antibiotics when it's possible. But the fact that people are abusing the use of antibiotics and treating them inappropriately, and as Darrell has mentioned frequently, the fact that we have meats that we eat that are treated with antibiotics becomes an issue that has dire consequences down the road.
Dr. Callender, I remember when my mom was at the nursing home after she had her stroke and heart attack. There was a case of C. diff that they talked about. But I was unaware that there were other bacteria that also can be associated
Oh,
with
E.
UTI.
coli is the commonest. Clostridia is probably one of the hardest to treat, but E. coli is probably the commonest source of urinary tract infection.
Dr. Callender,
Yes, yes.
what's the cause of reoccurrence of UTIs?
Often that means that you have something wrong with your urinary tract system, and you need to have evaluation by a urologist to see if there's something amiss with the bladder or the urethra or the but usually when you have recurrent urinary tract infection, it means you need to be evaluated by a urologist to find out why.
I asked because that was what my mother's problem was. And then she also had a problem where she got delusional. She had a high fever and got delusional. And
Which is not uncommon if you get an urinary tract infection, because
okay,
that could really give you a septicemia and a high fever, and that would make
right,
you
right.
so
I was
that's
just
treated
okay.
early.
So okay, I got you.
Yeah. It's more common than you would think, but if you don't look for it, you won't find it, and you need to examine the urine to find out. If you have more than 100,000 bacteria, that means you have an urinary tract infection that needs to be treated
Dr.
sooner rather
Kessler,
than later.
is there anything you can do to prevent it?
Probably the thing that you suggest is to drink a lot of, hydrate yourself adequately. It's probably the main thing to do. Not too many other things other than that.
Dr. Callender, some years ago when my mother was living, she also was a candidate for UTIs. But there used to be a kit that you could buy, like a pregnancy kit, to test your urine to see if there is any bacteria in it. Is that kit still available?
Not that I know of. I'm not aware of it.
Okay.
But
I know I had bought one for my mother, but she was so determined that she was not going to use it. I think that was when she was going through one of her stages. She decided she was going to throw it away.
oh, really?
Mm.
I hear everybody talking about older people with UTI, but when my middle child was born, they actually told me the sex of my son as we were headed to the delivery room. He was a breech birth, but once it was time for us to come home, well, actually he came home, but the next day when the visiting nurse came to the house, they took him back to the hospital because they said he had a urinary tract infection. So I wondered then whether he got the infection on the way to the delivery room or not. But I just mentioned it because that was a birth, and we're talking about older people now, but it happens no matter what age you are, I guess.
That's correct. It occurs in all ages, but when it occurs in younger people, you have to look for a cause, and sometimes it's some abnormality of the urinary tract system that a urologist may be able to evaluate and eliminate.
Yeah.
But you're right; it does occur at all ages.
I don't remember what their reasoning what the, cause. I can't remember what they said was the cause of it, but I just brought it up because,
Right.
it's an
Good
input.
point. Thank you for bringing it up. Yeah. Any other comments before we move on? Okay. This is interesting because the hormonal levels are important. Of course, we say that high testosterone levels is the reason that men get bald, but low testosterone in men is linked with higher risk of death as well, just as also from higher risk of cardiovascular disease as well. So that getting a testosterone level to find out what your level is and getting it corrected to normal may influence your likelihood of dying. This is something that is rarely discussed in men, the fact that your testosterone level can be normal or it can be low. And if it's low, this is a risk factor for cardiovascular disease and premature death. Now, the question is, how many men actually get the testosterone levels checked? And that's probably something that very few of us have ever actually done. And so with the knowledge of this might influence your doctor as you age to get your testosterone level, which would otherwise not be done.
Dr. Callender, is that a big deal? I mean, is it expensive or something?
No, it's not expensive. It's just that it's not thought of. Yeah. And I think this article might increase the thought of it. Of course, you have health risks associated with too much testosterone. But I think it's more often that it's not thought of as an issue. And so therefore testosterone levels are not done. Just like vitamin levels. Not all doctors do vitamin levels, but vitamin deficiencies cause many problems. This is a study to talk about how the testosterone levels should be drawn and what might make you think about getting your testosterone levels drawn.
Dr. Callender, does checking your testosterone level have anything to do with prostate problems?
I don't think that low testosterone level so far has been associated with prostate. You talking about prostatism or prostate cancer?
Well, let's go with prostatism.
I don't think it has anything to do with prostatism. There's some concern about whether or not it may be associated with prostate cancer, because one of the treatments for prostate cancer is to decrease the testosterone level.
Thank you.
Dr. Callender, how many men are aware about that bullet point number 4, not smoking pot, which can increase female hormone levels? Do you think they'll get a lot of men to stop smoking pot?
No, because I mean, they have to be aware of it. If they were aware of it, maybe so. But they're not aware of it. So.
And they don't publicize that either. I never saw that before. I didn't realize that.
Yeah, it's interesting because we're seeing more and more side effects of cannabis, but they still have a number of benefits. So its use continues to increase.
On
Yeah.
this,
Dr. Callender,
Yes.
one of my friends had he had his breast got larger, and the doctor told him that it was because of the marijuana he was smoking. Was that true?
Could be, because there may be ways in which the cannabis affects the sex hormones, and of course, gynecomastia may be related to increased estrogen levels, which is
Okay.
what they're talking about here.
Oh,
Right.
okay.
And there's a lot of foods that increase estrogen levels, particularly the cruciferous vegetables like cauliflower, cabbage, Brussels sprouts. Good for women if they need their estrogen level increase. Not so good for men because it increases estrogen levels and decreases testosterone levels.
Okay.
Dr. Callender, the way that the form that you take cannabis in, does that make a difference? You know, because smoking is the worst way probably to consume cannabis.
I'm not aware that it makes a difference, but I'm ignorant relative there too. So I don't know the answer to that question.
Yeah, men looking to increase testosterone levels should consider heavy strength training with weightlifting, and squats are the best exercise. They make the greatest increase in testosterone levels. And increase in levels may just last 15 minutes to up to an hour after strength training, but the best time for men to increase testosterone is to do strength training in the evening as opposed to the morning.
Mm-hmm.
Interesting. Thank you, Daryl.
You're welcome.
Any other comments? Now we can go to the next one. Erectile dysfunction is something that men become more aware of as time goes on, as they age. And of course, we've all heard about the medications that have been so effective, which actually initially were used for hypertension, but because it was so dramatically effective of treating erectile dysfunction, that they forgot all about the fact that it was a blood pressure medication. But when you have inability to have an erection, we call that erectile dysfunction. And that can be related to many things. Circulation is one of the commonest things. And if you have poor circulation to the penis, then you're likely to have poor circulation to the coronary arteries as well. And so when one has erectile dysfunction, one of the first things you do is try to see whether it's anxiety, or whether it's a nerve issue, or whether it's a circulation issue. And then if you find no resolution to that, or if you find ways to correct that, fine, you do that. If not, then there's always the medications that become so popular for erectile dysfunction. I think Viagra and its association drugs treat about 60 to 70% of those people who have erectile dysfunction. But those medications also have their side effects. But it is thought that first you should go to your doctor and be evaluated to make sure there's nothing else that's going on before you start going to the Viagra and the other treatments that are available. There are many other ways of addressing erectile dysfunction. The urologist is the person to go to get those treatments done.
Dr. Callender, is ED the same thing as Peyronie's disease?
No, it is not. Peyronie's disease is actually a disease in which the penis becomes hard, and so it's completely separate disease entity. Erectile dysfunction is simply inability to get an erection. Period. That's all. No other abnormalities. Just can't get it up. That's what they say in the street. Okay. It's interesting we talk about that in men, but we rarely ever talk about decreased sex drive in women. You know, it's amazing how our society is male dominated, because if a woman is a decreased sex drive, nobody talks about that. But if a man is erectile dysfunction, that is a cause for alarm.
That's a problem, but that's big problem. And diversity, equity, and inclusion has had us address it.
Not understanding your comment, Lucy, would you expand on it, please?
I'm saying that that's why it's so important for us to make sure that there are women that are involved in medicine, because we can address the issues then that men that men and their chauvinism has ignored.
You know, I used to, in our group that we have, this group, one of the things that we noted was that nobody talked about decreased libido in women. And it was kind of a cause for alarm for men if they had a decreased interest in sex. But for women, it was kind of expected. And your point is so well taken. It's so important. You're right. That's why we need to have diversity, because to me, a symptom of decreased libido in women is the same as the situation of erectile dysfunction in men. But because it's a male dominant medicine situation, or used to be, it's not that way any longer. But it speaks to your point and emphasizes the point that you're making.
I know my daughter would, she would tell me about how if a young man came into the ER and he had been in a motorcycle accident and something that had happened to his testicles or his penis, that was an all hands on deck, of immediate medical emergency. Everybody, come in. Yet, when we're talking about breast cancer, mastectomies, things like that, it's a completely different posture.
I'm not sure I agree with that, because I've had so many women die from breast cancer that it's a prime concern for me, and should be for most men, because our women who are dying from it. So I'm not sure the association with breast cancer, because breast cancer is an area that we are very concerned about. However, I appreciate your point. I just think that we have much more interest in breast cancer than we do about other things. That's all.
Dr.
My
Callender,
my comment. Go ahead, Carol. Sorry.
I've heard of women, and women will say, oh, that's a shame, or how does that happen? Where women have lost their sex desire and they just refuse, and they'll stay in a marriage and go years, maybe even decades without having sex. And is that a medical? I'm hearing now that's a medical reason, but nobody is pinpointing it, or what's going on.
Yeah, it's a medical issue, but we're so male dominated that we don't address it. But it's an issue, and it's a medical issue that needs to be addressed. Just as erectile dysfunction is addressed in men, decreased sexual libido should be addressed in women. What do you think, Lucy?
Absolutely. Absolutely. And I think that now that women, I think there was a big grant that was given to research in women by Bezos's wife. $1 billion towards medical research in women. I think as women become more independent and able to manage their wealth in such a way, we're going to begin to see the pendulum move on issues that are specific for women.
Well, it's interesting you bring up a point that our men are dying and leaving the money to the women. So you women have all that money that you use after we leave. So
Amen.
it's food for thought.
Amen.
So what advice would you give to couples, whether it's a male or the female, and their low sex drive? Could you just give both of them examined for medical reasons? Because
Yes.
that's a thing that women might talk about it, or men, or something like that, but there is nothing out there to let women know that that's a medical problem. Now, men know that's a medical problem, and society actually laugh about it, but women, that has never been stated that that's a medical problem almost.
Well, that's interesting because in our group, we did say that, particularly to the women with end-stage renal disease, because we recognize that decreased libido was an important, but here's what is the interesting thing about it, was that the women didn't really complain that much about it. We brought it up, and after we brought it up, it became an issue that they recognized, but it wasn't something that they actually felt was a top priority, which I think we have to change that.
I
Lucy?
kind of, oh, go ahead, Doc.
I'm gonna ask Lucy to respond.
Before Dr. Perez, let me just interject this. Our age, maybe not so much now with the younger generation, but the age group that's on this panel, basically, women, the men were always the aggressor. They were, it was kind of unheard of for a woman to ask for sex. So, we waited for the man to make the approach. So there was no thought of something being wrong with us. It was just, we were waiting for the man. And, so it's kind of.
That's why, for example, we had to draw it out because I had to ask them specifically because for exactly the reason you gave, that they were waiting. And then actually after a while, they were comfortable with not having a desire to have sex. Any other comments?
Well, I think that's a societal, as you were saying, generational norm. You know, it was, I think, I can't even remember what song it was, but you know, you want a woman who's a lady, but a freak in the bedroom, you know, so that was, women were not supposed to even enjoy it. That's a new concept. And I think it's women who have the opportunity, who are being heard, who who appreciate the fact that they should enjoy sex as much as their partner.
You know, in the old days, they used to talk about the woman with the white liver. That was the term that was used for the woman who enjoyed sex, which is really ridiculous because, as you say, it's sex that's been enjoyed by men and women alike. But that shows what happens when you have a gender, male gender dominant. The issue becomes that it's the male who goes for it, not the woman.
Dr. Callender,
Yes,
there are cultural um things with that because they have that in some of the Arab and African and Asian countries, they do that female mutilation because they don't
clitorectomy.
want a
Yeah,
woman to enjoy sex.
that's exactly right. As a matter of fact, that's why they do that operation on women, clitoridectomy,
Right, right.
so they won't enjoy sex. So you're exactly right, and they still do that today.
Mm-hmm.
And I think it's also associated with and has to come into the conversation of domestic violence. And the issue that a married woman cannot be raped by her partner. That's absurd. But it's a different cultural consciousness that's very important that it be shared and discussed.
You know, Dr. Rick,
That's an issue that is rarely ever discussed.
you know, I didn't know you were going in that direction, Dr. Perez. I thought you were going to say, when you were talking about domestic violence, I thought you were going to say that that could take a woman's desire away too.
It may do that as well.
Absolutely. The whole issue. I know I cut my teeth on HIV disease, but with that, I always thought it was a issue of exposure. But when I went to a conference on the continent and I saw queens and princesses that were well educated, wealthy women who had become infected, I realized that the issue in HIV was an issue of sex and power. Having the power over a woman. And that just completely changed my consciousness about preventive strategies for HIV disease. Because it was an issue of power over the bed.
Well, you're addressing an issue that is rarely discussed.
I'm glad we're
To discuss.
I'm glad we're discussing it because I think it's very important for HIV disease in particular. It was an issue that needed to be primarily addressed with men, but we never did that.
Never have, before or after HIV.
Absolutely. So with the brilliant minds and their circles of influence that are on this phone is something that we must do.
Who's gonna do it?
We are going to do it.
Okay. Okay.
Just by what you are doing, Dr. Callender, just by this conversation.
One thing I've noticed talking to younger women, their mindset on female and actually enjoying it has changed dramatically than my generation. And they no longer feel inhibited about saying that their desires for sex or even enjoying it is like ours. Ours, it was a taboo. You are a scandalous woman if you desire sex. And one time in high school, the kids and the society still has this about older people. And then when I point out that there's more venereal disease and old folks home, they seem to think that when you reach a certain age that desire goes away. And I remember, and I thought that too. I was hearing my mother in her 80s and she was talking to her sister about it. And that's almost a taboo, but women very seldom talk about, the younger women do, but the older women do not talk about their desires of sex and etc., especially the single women.
Thank you very much for the discussion. Any more discussion about it? If not, we'll go to the next one. And keep in mind what Dr. Perez has given us as an assignment. HPV vaccination is linked to lower risk for related cancer among men. Now, this is an association that has been a long time coming, but is finally recognized that HPV is a very common sexually transmitted disease. And it causes cervical cancer in women, but it also causes oropharyngeal cancer in men. And it helps us appreciate that having men vaccinated becomes very important, as well as having women vaccinated, because it reduces the amount of cancer in men and women. And that's something that is often, of late, it's being discussed, but it is often unappreciated. So that the merit of having the young kids vaccinated in school has dividends as they age. And this is what this article is pointing out, that HPV, which vaccination, which is required in schools for boys and girls, is especially important for both sexes. It's just that some of the sexual diseases that occur in men occur later on.
On this point, a couple decades ago, there was the bomb in Gilead, Prenessa really pushed this issue by having the Methodist missionary societies. So that's WMS in the AME church, but Christian Episcopal, as well as AME Zion. Their female leadership, which was associated with missionary societies, got together and we were having Saturday morning brunches to talk to women about HPV and to talk to them, to bring out biblical references about sex and about abuse in the Bible and ways, because now when you talk about men, you're talking about sexual activity, how they got the papilloma virus in their mouth. So then you have to talk about positions. And what we did was we had these Sunday morning or Saturday morning breakfasts that no men could come into. And there were courses where women had to feel their bodies, know where their cervix was, things like that. And it was a revolution. It was a revolution in the church talking about sex. And now to see that this is pushed heavily to make sure that men are not at risk, I think is very important. And I think that conversations like the one that we're having now will have an impact on our children's children.
I had a question, Dr. Callender. If you get vaccinated as a child, does that uh, uh, last for your whole life?
It appears so. It appears so. Haven't seen any studies on adults who receive HPV as a child. So I don't know, because we haven't been doing the HPV that long, but so I don't know the answer to that question. But I believe that it is expected that the HPV vaccination is long lasting.
And they're recommending that you have it well into middle adulthood. I
That's
believe which was not, 20 years ago, that wasn't the intention. And I wonder whether having this longer period of time, because the crux of the matter was getting parents to have their children vaccinated around an issue, i.e., sex, that many of them had not even discussed with their children, let alone bring in sex education. And now you're vaccinating their children about something that parents had a hard time imagining their children doing. Because I ask you, close your eyes now and envision your parents having sex and enjoying it. That's hard for me. My parents only did it 3 times.
Yeah, okay.
Dr. Perez, you were in a progressive church, because I was in a class of discipleship, and all women, and it was in a series. It was a booklet, and it came to the chapter about sex. And the teacher of the class, she said, we're skipping over this section because sex has nothing to do with your discipleship for Christ. Because that was how uneasy, even though it was a class full of women, we were in a close corner, nobody could hear it. But they decided, and I just looked at them, they just decided that sex had nothing to do with the discipleship. And they were talking about the whole female. But it was these group of women, they felt on it, they felt that, on at ease of talking about sex, even among women.
Wow.
So that was in a Baptist church. So I might have to change my whole denomination altogether.
That's
There were no young women in that class.
No, there weren't
you-
any young women, because young women are altogether different than my age group. Sometimes I'm wondering what age group I am. And I have taught sex education when it was mandated in DC public schools. And at that time I was a counselor, and I did teach sex education. Now it's not mandated, but it was from pre-K through grade 6. And I had to become educated and do my lesson plans and everything like that. But, we have all these different various mandates, and they come and go. But then it was easy for me. But my age group is just hard. Women, they just can't discuss it unless it's just one-on-one, maybe.
Well, we got to
Okay.
do something. And I think it's very important that we do it. Because there are benefits. There are benefits. God blesses sex and marriage. He really does. And I think that there are a lot of relationships that could benefit for some good sex. And maybe they'll stay together. Maybe we'll build greater Black wealth because of it. We've got to discuss it.
Okay, well, you know, on the one hand, our society and research tends to be very sexist, where there's a lot of research given towards decreasing male libido, but not necessarily the same research on the female side. But on the female side, at least y'all talk about it. Like, I can't recall ever talking about with another guy sexuality or erectile dysfunction or any of the problems associated with male sexuality and aging, or even on as a young man, sexuality and how to approach women, how to some people do get training these days, and there's a whole lot more training, but it's usually through pornography, so it's the wrong type of training.
That's why we are Dr. Callender's disciples. We have got to go out there and we've got to talk about this.
Well, I think Daryl has hit on a subject that is very important. The fact that you talk about women not talking about it, men don't talk about it either.
Dr. Callender,
Yes,
do you remember when the Surgeon General, it was a woman Surgeon General, and they made
sure.
her resign because
Joyce
she was
Elders,
talking, I beg
Jocelyn
your pardon?
Elders.
Yes, and they made her resign because she was talking about
Masturbation,
sexuality and masturbation.
right. And she was right on target.
Yes,
Yeah.
she was. I remember that.
Jocelyn Elders.
Smart
Mhm.
woman.
Yeah, Dr. Perez works with her. Still now, right?
Yes. African American Health Alliance.
Yeah.
Providing information to our legislators about health,
Yeah.
especially.
It's amazing how truth is not appreciated.
Right.
You're right. She was forced to resign because she told the
Mhm.
truth.
That masturbation was a preventive strategy for HIV disease in adolescents.
Right.
As if masturbation, causes blindness.
Right.
Did you hear that? I heard that. Oh my gosh.
Yeah, that's
And
that's accurate.
it also causes hair to grow in the palm of your hand. Made you look. Well,
Okay,
here's how I know that men don't even talk to their primary care providers about sexuality or
no,
erectile dysfunction, because there's so many commercials on TV on radio about erectile dysfunction products like Roman, Get Him, or there's all kind of ads. And with all of these ads, the prices are high. If they just talk to their urologists about it, well, then the urologist would give some urologists, not all, will give them a lot lower price prescriptions than any of the advertisements that they're hearing, any of the commercials. So, like all these commercials are being targeted to men who they know will never talk to a urologist or their primary care doctor about the problems.
And so now you can get it for telehealth. All you have to do is call this number, and that's scary. That's very scary. That kind of drug without any other information. That's scary.
it's unhealthy. Yeah, okay, well, we've discussed this ad nauseum, so let's
One
move
last
on.
question, Dr. Callender. Is a sexologist a bona fide field of medicine? Sexology?
Not that I know of. We talk about gynecology and we talk about urology. So in many ways, that's where it is done. The sexual aspect of men, and of course we have many female urologists now, and gynecologists who have males and female. So that's where the sexology aspect is present, as well with the primary care physicians.
Thank you for that.
This is
But
an article.
so much, one last thing. So much of what we're talking about as it relates to sex, as it relates to pain, has to come back to our mental health. Because so much of this is how we mentally and emotionally deal with, understand, and appreciate sex.
Okay, thank you.
Yeah.
Uh,
And there's no such thing as a serial killer who has a healthy, enjoyable sex life.
Touche.
That's true. That's it's amazing association though. Yeah. Well, moving away from the brain to
Oh, I just got one more question. Because mankind knows this, what are they making people crazier when they incarcerate them and allow them nowhere to get they feed them food, they give them exercise, but there's no sex. So how do they help that whole man or whole woman when they incarcerate them? Do they ever think about
Masturbation.
that? Or are they making them worse?
I don't know the answer to that question.
Well, actually, if you listen to Elvis Presley's Jailhouse Rock, you'll understand.
I
John
also
Tatum, you
heard,
had a comment?
yeah, I heard that in some states, conjugal visits are allowed.
They are. Okay, moving on to this article talks about cervical cancer screening. And I think my daughter's going to be talking to us on the 13th about gynecological aspects. But this is the confusion that exists in the gynecological world. And the American Cancer Society and other groups have different screening parameters. And a lot of it is related to the pap smear and the HPV. The fact that HPV can prevent cervical cancer, pap smears diagnose cervical cancer. So there's some disharmony in when to do one or the other. And this article talks about the fact that we need to have unanimity of purpose, which we do not have. And it all relates to the fact that what we're emphasizing now, as we talked about with HPV, is that this is a test, this is a vaccination that will eliminate cervical cancer. And so if you actually have had HPV, then the likelihood of developing cervical cancer is unlikely. So therefore, the influence on HPV would take away the need for the PAP test for many people, for those people who have already been vaccinated. And so because of that confusion, there's a lack of unanimity among the practice. Some people are getting the pap smear, and some people are getting the HPV vaccination test to see if you've been vaccinated. And if you've not been vaccinated, then the pap smear becomes very important. If you have been vaccinated, the past smear is not as important. But we're not together on that. And that's what the issue is of this whole article, is we need to be together and have one size fits all, which we don't have for the management of cervical cancer.
And I have to point out how important reproductive health care is, because most women of childbearing age receive their health care from entities, from establishments that Planned Parenthood clinics and things of that nature. For many women, because of the politics associated with reproductive health care, that major segments of our population will not have access to health care. And I think that's very, very important. And its impact on Black women is very significant. And I don't think that Black women associate reproductive health care as much with their ongoing health care as they should. And it's a very, very important political issue as we're going into our elections in November.
Okay, if there's not any other comment, let's move to the next one. This is something that we actually showed before, that HPV coverage was increased in adolescents in France, and we need to do something similar in the United States. It's hopeful that this increased appreciation of the role of HPV vaccination will totally eliminate cervical cancer, as well as decrease the high incidence of oropharyngeal cancer in men. Let's go to the next one. This is a negative article that talks about the fact that aspirin is not therapy for breast cancer. And they did a lot of studies. Some data initially supported this treatment, but now all of the large data elements have identified that with the double-blind randomized studies, that aspirin is not treatment for breast cancer, any type of breast cancer. That's what this article is all about. Not that many people really used aspirin as treatment, but this eliminated that anyway. Let's go to the next one as well. Now this is something that, the age keeps dropping on a number of these screening tests. We talked about the PSA and getting prostate evaluations at age of 40. Colonoscopy probably should be at the age of 40. And now we're talking about routine breast cancer screening with mammography at the age of 40. And some believing that after 80, you don't need to get mammograms. But again, that's debatable as well. But one thing is clear, is that the starting age of mammography should be around 40, because, and we also have patients who are younger than 40 who have breast cancer. We have patients who are in the 20s and 30s. So we don't have a whole lot of patients who have breast cancer at 20, but we do have some, and we have some at 30. So taking down to 40 is a good step in the right direction. Now, go ahead.
And it was the National Medical Association that pushed and pushed to lower the age because of the prevalence in younger Black women. And so those that you have educated, those that you have advocated for, have pushed ahead to make sure that we have these lower age limits for insurance payments for these tests. And I think that is very, very important. If there weren't young Black physicians that pushed to make sure that this age limit was reduced, it wouldn't have happened.
Very good point. And we need to continue. Also, the now ultrasound for dense breasts, which has been a long time coming as well.
Dr. Callender,
Yes,
I think they need to do something about the way it hurts, because and I think it should be taken seriously. I've said that to a number of doctors and they dismiss me.
well, you shouldn't be dismissed because there is
No, it shouldn't be, and it shouldn't hurt. When I went overseas, they had a machine over there that you laid on the table, face it down, and your breast came through in the mid. It had some openings for your breast, and that's how the test. That's how the test was taken. You didn't have to have your breast smashed and jammed and be uncomfortable doing it. It was
well,
almost like a punishment.
I couldn't agree more because all the women say the same thing. And they have a new Genius X-ray that minimizes that. And so that's the X-ray of the future. That is exactly what you're talking about. Because one thing that is unanimous is that all women who have mammographies say the same thing that what you just said. And so this is something that's coming. And it's actually here now. They call it the Genius mammography. Next article, please. This is an article about the artificial pancreas for managing type 1 diabetes during pregnancy. And actually, this is something that finally has gotten FDA approval. Actually, the many techniques of insulin directed therapy by other technological mechanisms have been used and are still being used. But anyway, this is a new system that is recommended. As we know, during pregnancy, the diabetic control becomes difficult. And so this may be helpful in keeping the diabetes under control during pregnancy.
So, Dr. Callender, is this only for women who develop the diabetes during pregnancy, or could this?
No, it's for women who have diabetes during pregnancy.
Oh, okay. But is this limited only to women?
Yeah, the artificial pancreas. Yes, this system is.
Dr. Callender, as you know, my daughter came down with type 2 diabetes at a very young age. And I think
Type 1.
Type 1. I think, how old was she, Carol? I think when she was in the military,
When she was, John, when she was pregnant with her first child, she developed it then. They thought maybe it was that, but then they realized it was type 1.
yeah, well, that was my point. I was thinking that the pregnancy her first pregnancy resulted in type 1 diabetes. So connecting up Buchanan's question, you know, she's beyond having babies now, but she still has type 1. So would this kind of artificial pancreas help her at this point?
It has potential. It has potential because you know the nowadays they have so many devices that they put inside the skin that monitor the blood sugar. That for many people, it's effective, uh, and so the artificial pancreas, which this is something that might be applicable to her as well. Because when you're talking about type 1 diabetes, you mean that you're not producing insulin. And so this kind of technology would be beneficial.
Thank you for that.
Okay, let's go to the next one. This is interesting. We've always wondered how music was so helpful for older adults and even the Alzheimer patients. And now they're identifying the brain sites that actually are affected by the music and identifying the areas of the brain that respond to the music. And it's amazing how even in people who have Alzheimer's that the ability to respond to music and actually even play music. For example, Tony Bennett, even up until he was almost dying from Alzheimer's, he could still sing. And that was at the age of 97. And this is something that we're recognizing now that the brain networks that respond to music is something that persists over time in the presence and absence of dementia and Alzheimer's disease. And suggesting that the role of music therapy is something that is underutilized. And so it's time for us to find ways to be more aggressive with music therapy for people with Alzheimer's and dementias.
Dr. Callender, I heard of a guy who played first trumpet in the Chicago Symphony Orchestra for 60 years. And a few years ago, he retired from playing first chair trumpet in Chicago Symphony Orchestra at 80 years old.
Playing since he was 20, huh?
Yeah, playing, yeah. And so, you know, after the guys retire from the symphony orchestras, they go out and get side gigs and stuff. So he's probably still so hot that he'll probably continue playing for another 5, 7, 8 years.
Don't limit him. Don't limit him. You never know.
I know in our family, my aunt she became nonverbal from her dementia, and her nephew sent music. Mahalia Jackson told me to play a tape for her. And after weeks of being nonverbal, just hearing the music had her reconnect. And it was a wonderful thing. And Dr. Callender did that
Yeah, I remember.
long before this research.
Yeah,
You
I
know,
remember that.
I have a similar story. I tutored a lady who played piano, classical piano, very good at it. And then somehow along her life, she lost her sight. And her memory of all the classical pieces that she played, she lost it all. And so we painstakingly went over some of the songs that she used to play. And it helped her, limit her depression about the loss of her sight.
I'd like to add,
Janice, do you want to say something?
No.
Oh.
I was just going to say, in thinking about music and patience, and sometimes we don't know what certain patients can hear. It just took me back to my husband and in his last day, and we knew that he wasn't going to make it. And this happened in the height of the COVID, and everything was limited. Grateful to my son and I, we were able to remain at GW Hospital for days long after everything shut down. And the last day, and we knew that was his last day, and we're the only ones in intensive care. And my husband loved Earth, Wind, and Fire. It was blasting. And we could almost see a smile on his face. And did he hear it? Did he not? At what state was he in? But oftentimes we think of music as being a healer. But he loved Earth, Wind, and Fire. And that day, intensive care at GW Hospital, we were blasting it for hours. So that's what this conversation made me think of.
Thank you very much. John, you
I've
had
got,
yes, I'd just like to remind everybody that if you look at this article, we can't play it now. If you look at this article, that link right there is an active link to take you to this a video about elderly patients and music.
Okay.
I've got a comment for the musicians on this group session, and that's about natural tuning, 432 hertz. 1938 American Association of Standards said that music in America should be produced at a 440 hertz tuning. And so that's the music that we consume today. But 432 hertz is the natural frequency of the body and the earth and the universe. And there's artists such as Jimi Hendrix, John Lennon, Bob Marley, and Prince all tuned their music to 432 hertz. And so studies have shown that at 432 hertz, the heart beats slower, there's lower blood pressure compared to 440 hertz music. So it may be a good idea to tune your music to 432. Make it easy on yourself.
Tune your instrument because I don't know what we're going to do about all the recordings that are already out and all the performances that are already happening with 440. It seems as though you can, like playing the electric bass or something, you can tune that. But will you be out of tune with everybody else? That's the big question. I don't think that the mind can determine the difference. You have to have a real good ear to determine the difference between a 432 and a 440.
Naturally, you determine that because that's why people sing flat. They're singing flat, trying to get down to the natural tuning. You train yourself to sing at 440, but that's not natural for the body. Naturally, you'll want to go flat to 432.
Yeah. So my question is though, the human ear, if the piano at my house was on 432, would you know it? As opposed if my house piano A was 440. I don't
Yeah,
think.
you would.
Huh?
Yeah, you would. And guitar players know this especially. Um, as far as like tuning up a guitar, 432, 440, there's a difference. You'll hear it. A lot of guitar players, and it could be bass players too, um, if your ear is good enough, you can tune your guitar or your bass. You can tune it by ear without using a tuning reference.
So what happens when you play with other people though?
Okay, if it's like Prince and his band, everybody tuned to 432.
No, I'm talking about, the average gigs around town. That's what I'm talking about.
The
John B.
average one.
Weigh in on it.
I don't know
Your
anything
vein.
about the tuning and stuff that you all are talking about, you musicians are talking about, but thinking about memory and getting old, I listen to old music that I loved when I was younger, and I'm trying to keep my mind now before I get to that stage. So I listen to the music I listened to back when I was a teenager, and it brings back my memories. I can sing all the lyrics and everything to, the music that I loved back then. And I'm hoping that that's going to keep me from getting dementia or whatever later on. I will prolong it a little bit as long as I continue to sharpen my memory with things that I remember. So I constantly listen to old music that I love.
That's a good
Okay,
thing.
Elizabeth, you want to make a comment?
Yes. Good morning, everyone. Good morning, Dr. Callender. Yes.
Morning.
I was just reveling and thinking about music. I taught sixth grade. That was my favorite grade. And I didn't have the experience like you guys, but I did take, that one class in college, music history. But I always played the classical piano music for my students. I had that ongoing, okay? And you was to look at a student when they first walk into the classroom and to see the mental transformation of their whole personality change. Some, you know how students are, some come in angry, upset, different things happen. And I always tell them, leave that baggage outside. And you could see when that classical music is played in their ear, how relaxed they become. And so I always played classical piano music for my students. The main thing I wanted to say was, my mother of 97 years old was placed in a rehab center and was expected not to be discharged. They had already told us that she was going to be there for us to expect that. Okay, because my sister and I, we had a different opinion. So at first, her words were not understandable. We acknowledged her talking. We went on pretend like we understood, and we had conversation with her. So when I arrived in California, what I started doing was every morning that I arrived, I would tell her, come on, let's get dressed so that we can go to church. And we went to YouTube church every morning, which gave us the music, the scriptures, they gave us everything. Before that 30 days, near the end of that 30 days, she began singing the words of the songs. Her words became clear and understandable, and she was discharged before that 30 days was up. So thank you.
Thank you. Okay, I think it's 10:30, so I think we can close up shop today. Interesting conversation. Thank you all for participating. Okay. Wow.